So Buzu, this is SciFi Talks, and this is a program to get the views and present and future of life sciences from academicians, entrepreneurs, and investors. For my today's episode, I have a talented guest, an entrepreneur, an engineer, and a CTO of the new startup Epilab, Clement Dubois. Welcome, sir.
Thank you.
So first, I missed some of your introductory parts. So how do you define yourself as an entrepreneur, as a person?
Okay. Hi, everyone. So I'm Clement, like Larsen said. I'm an engineer. So I graduated as an engineer a few years ago from École Centrale Paris in France. I focused in biology, and today I will define myself as an entrepreneur. My focus is to bring the science projects, the science research to basically the market, to create value out of the scientific research. And this is the first company I've created. So Epilab's goal is to develop a diagnostic for tuberculosis, but my goal would be to create solutions out of scientific research, the solution for major issues. So this one is a health issue, but I believe we could solve many problems, such as global warming or this health crisis, through the scientific research.
Who are your major customers?
Okay, so Epilab basically is based on a technology from INRA in Dijon. So we created the company with another engineer, Maurice Lubetsky, and with the two inventors of the technology, Muriel and Elodie. And their technology was created based on the fact that you have a huge problem in diagnostic. So each year you have 10 million new cases in tuberculosis. And on those 10 million cases, you have 4 million people undetected. So you have 4 million people who are not diagnosed, so they don't receive the treatment they deserve. And you have 4 million people who are also a big vector of contamination. Tuberculosis is an aerosol like coronavirus, so it's a huge problem. And basically those 4 million people will die and will cause the 10 million cases next year. And what's the reason for that is that every test existing on the market right now require some infrastructures. So they require some trained staff and some infrastructures, which are a problem in our country. If you had only COVID tests that require infrastructure, it would be a huge problem. But it's even a bigger problem in developing countries where most of the tuberculosis cases are located. So just to finish presenting the problem, if you are living in Benin and you have tuberculosis, you have maybe to walk 100 kilometers to get diagnosed, because every diagnostic test are based in labs. So you want to walk the 100 kilometers and you just don't know you have tuberculosis. And so what we're developing is a portable and easy to use test that can be deployed anywhere in the world, and that can diagnose people in their home, in their small villages, and basically to bring the diagnostic to those population.
Yeah. Does it look like a pregnancy test kit, or?
So this is the prototype.
Okay.
It's one of the prototypes. I'm sorry, I didn't bring one more. But so basically you have it's based on sputum, so you have to spit in the tube. You plug the tube here, right there. So you have a tube like that. And inside of there is Microfluidics working with the scientific process invented by Elodie and Muriel, my associates. And so you spit in the tube, you mix the tube, and you plug the tube inside of this cartridge. And you just put the cartridge away, you wait for 2 hours, and after 2 hours, you plug this inside of a small reader, the size of an iPhone, something like that. And the reader gives you the results. So this is thrown away, it's a consumable. And then the reader stores the data and gives you the results.
But how the idea was generated?
So basically, the first part came from Elodie and Muriel, the two inventors of the technology. They were working together. They are both scientific, and in France it's called enseignants-chercheurs. So they are both teachers and researchers. And on the research part, they started working on mycobacteria. So mycobacteria are the microbes responsible for tuberculosis.
Yeah. And
so they were working on that. They tried to detect mycobacteria in the environment, and they realized that detecting mycobacteria causes lots of problems. You cannot do it easily. It will take 2 weeks. It will take big machines. And so they said, okay, Muriel is a specialist in electrochemistry. Elodie is a specialist in mycobacteria, basically. And so together they said, okay, what can we do to find a new detection method? And so that's what they did a few years ago. They created the new detection method based on an enzymatic reaction combined with electrochemical detection. So when I said that in the end you plug this into a reader, the reader is an electrochemical reader. It's like a glucose reader. It works the same way. And so they, based on the problem they faced, they created the scientific process. So they in the lab they were mixing some reagents and using the electrochemical reader. And with Maurice, so that's the first part. The second part is that they put a patent on this technology. And a few years later, Maurice and myself, we were looking for a project to work because we graduated as engineers and we wanted to work to resolve a problem. We wanted to put our minds, our focus on a project that makes sense and that is based on a real technology. And so we contacted several scientists to tell them, okay, what's your technology, what's your patent, how does it work? And when we talked with Elodie and Miguel, we found it really interesting and really promising. And then when we looked at the tuberculosis problem, we said, okay, that could really help the fight against tuberculosis. And that's basically how it emerged. And so the work we did at the beginning was to take the process and put it inside of a small thing, to say, okay, this works in the lab, let's put this inside of this in order to bring it to people.
Early stage, there was no microfluidics. There was just electrochemistry and just enzymatic reaction. So
at the beginning, no.
Yeah. Okay.
No, but indeed, I had microfluidic lessons in my school, and that's one of the first things I thought about. Okay, like this looks like a promising process. How do we compress it in a small test like that? Let's look at microfluidics.
So most of the people are interested in entrepreneurship and want to start the company, but they do not have the idea. So you think that if we approach to the scientists or the academicians or who have patented their works, then in that way also we can do the entrepreneurship or get the idea, right?
I strongly believe in that. Okay. That's deep tech. The word deep tech is basically the principle of taking technologies from the laboratories, so from the scientists, and bringing it into a real product to the market. And I strongly believe that's a product that's based on a patented technology.
How do you know that which technology or which scientist to contact? How do you know that? Is it random talk?
No, it's not random. In France, you have something called SAT. So they are this SAT translates as Society for the Transfer and Acceleration of Technology. Okay. So basically taking a patent on a technology and building a product with it, it's called the valorization, the transfer of the technology. So when they are in France, those SAT, it's SATT, you have maybe 13 or 12 SAT in France. And those SAT, their work is to speak with the labs, to speak with the university and say, what did you do this year? And say they have the markets and the business focus, so they can say, okay, your technology on the tuberculosis looks promising. Let's put some more work. Let's patent that. So you can go to the SAT website.
Okay.
But you can also look at publication, scientific publication. Like I was looking at recently some recycling publication, and I'm going to contact the scientist saying, okay, how does it work? What did you do with it? Is it patented? Do you think we could do something with it? And most of the time, scientists are really happy to be working with people saying, okay, we looked at your technology and we believe we can do something with it, and there's nothing more valuable for them.
The company people, they do not dare to go to the low-income country because I think they believe that there is no money in the low-income country. So there is impact because tuberculosis is eradicated in the high-income countries, but in the low-income country it is existing. So how do you know, or how do you think that it is perfect for the business?
It's a challenge, indeed, because as you said, tuberculosis is nearly eradicated in high-income countries, and in low-income countries you have more TB, but you have less money. And you were speaking about investors at the beginning. So investors just don't want to look at your project most of the time. When you say my main market is based in Africa and South America and South Asia, they just will tell you, okay, it's going to be difficult. I'm not going to invest in that. But the first thing is, with impact, you can find some other kind of investors. So you have the VCs who are looking for profits, but you have also family offices, business angels who will say, okay, this project makes sense. It might be a bit more risky, but I like the impact it might have, so let's invest in that. And I believe that's how we found our first investors. So the first thing is you can find investors, you can have a market. It's going to be more difficult if you're working on an impact project that focuses on the low-income countries. But the other thing is that you can have impact on high-income countries' markets. Like, for instance, if you want to work on a global warming solution, you will sell this to high-income countries. So you can have impact while being on a high-income market. And the last thing might be that, for us, for instance, tuberculosis is not eradicated in Europe. There are 5,000 cases each year in France. You have a migration migration flux, so those migrants may have tuberculosis. So there is a need for tuberculosis diagnostic, for instance, in France. And though it's not our focus, you can propose and you can sell those tests. You can sell those tests to big companies working in Africa, for instance. So you can always find a way to say, okay, there is an impact in the most of what I will do, but I will also be able to make some profits. For instance, if you are Total working in Africa and you have some employees with tuberculosis, you lose a lot of money. So we went to see Total and said, okay, if we were to sell you a test, would you be interested? And Total were really interested for this test, and really interested at a way higher price than what we will sell the test. So the test Epilab will be sold $5 for each test like that. Okay. That's basically for us to survive as a company and to be able to recruit some people. But Total we would agree to buy that for $20. So we can find other. What I'm saying is that you can find alternatives to sell your product, your impactful product, in a way that's more profitable for your company.
Another challenge is the legal part. So there's some kind of approval we need, because before selling the products in the market, we need to have some kind of approval. So what's your strategy to?
Basically, you just have to take it into account. Like when you are, you just need, yes, it's as easy as don't forget it, work on this part, and it's the regulation. So like when I recruit someone, I need to see my lawyers, I need to do some few paperworks. I'm not going to recruit someone like that. And the same way, when you are going to sell a medical device, you have to follow some regulatory path. You just have to take this into account. And for instance, we recruited someone in our team to do that full time. But that's just a way. You can also work with consultancy firm. So it's difficult. It's complex. It's a lot of work that doesn't seem to be useful, but you just have to do it. So put some energy and money into that, and it's going to be enough. And just one thing I wanted to add about the impact thing and the thing that it's going to be difficult if you are selling your product to low-income countries. Yeah. This is true, but you can also have the help from non-profit organizations. Yeah. So, for instance, we are working with the WHO, with the Gates Foundation, and these organizations are powerful. They have money, and they can really, really help you if you have an interesting product.
I mean, the major hurdle will be to validate the product, right? To validate, how will you collaborate with the hospitals to validate your product before selling in the market?
Basically, we are already collaborating. One of the challenges of what we do is to work on real samples from real patients. Yeah. But as you said, there are not many TB patients in France. So we had to go to the National Center for Tuberculosis in France to see with them if they are interested in the test, to see with them if they would like to work on it with us, because of course we need to have this medical expertise to develop the test, and so we are working with them to develop the test, and in the second time to test and to make to realize some clinical trials.
So let's talk about the sustainability, or feasibility. So do you think your company will be just focused on the tuberculosis, or do you have any plan to go to the other products?
Of course, we have plans to go to other products and other diseases, because this is going to be interesting for the process we have. But imagine if we just could use the same hardware, the same factories, the same everything the same, just some different regions to detect malaria, to detect HIV. So we know we can do that in theory. So we just need to put more work in that. But of course, we will focus on other diseases. Right now, we are only focusing on TB, but we, of course, are thinking about many other diseases.
So do you think the paper-based assays are, so how do you compete? Do you have any strategy to fight with them?
The lateral flow assays are way less sensitive than what we do. So for instance, the COVID test that the Chinese company claimed to have a 90% sensitivity appeared to be in the end 30% sensitivity when we did some real research in France. Yeah. So that's the first answer. And the second answer is that we are working on lateral assays. So I think it's just another technology. Like PCR is way more sensitive, but you need big machines, so it's more expensive. You just need to find your equilibrium. Yeah. And just a last thing is that the lateral flow assay require to be stored at low temperature. So one of the strengths of the Epilab process from Elodie and Noel is that every region is stable at high temperature, which is not the case for basically all of the tests you find on the market. And that's one of the main demands from the WHO. So the WHO, a few years ago, launched some specification for a new kind of test. They said, okay, we need this new portable test. And one of the main demand was to have a stable test, because of course you cannot bring a test in a small village if it's not going to work when the weather is too hot.
You said that you have the enzymatic reaction that is patented, right? So that is your secret. So that is the patented thing.
Yeah. It's not a secret because you can find the patent online, but it's the protected.
Okay.
And the protected part is actually the combination of the enzymatic reaction and the electrochemical detection.
So nobody is using the same enzymatic reaction like you were using, right?
Yeah. That's the core of the technology we use. But if you want to talk about IP, intellectual property, yeah. Of course, as a company, we need to have more intellectual property. So we will put a patent on the test, on the hardware once it's created.
Just let's talk from the beginning. Let's like you got an idea and you thought that idea could be a startup. Then you made a startup and you collaborated with the people. But how does this happen? Like a lot of collaborations, and you also got a lot of awards, funding. So does it happen in a flow, or how did it all happen?
It has to happen in a flow, otherwise you're not gonna. It has to happen in the flow. But basically, for instance, if I take for my part, the first time I heard about this is I was on the SAT, so the Society for Transfer and Acceleration of Technology, was on this website looking for technology. So I found this technology which is called a new process to detect tuberculosis. I look at it, I say, okay, this looks interesting. I go to see the market of tuberculosis, to see the problems. I say, okay, this looks really interesting because there is this huge problem of the 4 million people not detected. Okay, let's look at that. Then a week later, I contacted Elodie and Noel. We have a talk. They explained, okay, that's the patent, that's the technology. We signed an NDA, of course. They said that a non-disclosure agreement. So they present to me everything, all of their results, and I say, okay, let's try to see what we could do with that. That's when the microfluidics, the engineering part arise, because they are scientists, they have the idea, the project, they have the process, and that's where the engineering thinking comes. So this is the moment I started to think about the product. And at the same time, so then there was maybe a question, I contacted maybe many doctors, entrepreneurs, industry guys, finance guys, saying, okay, I have this new technology, I have this market, what should I do? And so some people told me, okay, look, be careful at the regulatory path. Some people told me, okay, just be careful with the data they have. So I talked to Elodie and Noel to see the data. And then on and on, you just create a project, you just create a roadmap saying, okay, I have this product, I have this process, I have my ideas. How do I put the product on the market? And I think to answer your question, which is how does it come to a company, is you have to create your roadmap. You have to, if you are experienced, you can do it yourself. If you're not as experienced as I was, you have to ask a lot of advices to a lot of experienced people. And that way you will create your roadmap. You will have more and more questions emerging. Also, every time you have a new idea, you have a new questions. And every time you have new answers, you have new questions. And so the work is to answer all of the questions and create a roadmap that makes sense. With this roadmap will come some recruitment you will need and some money you will need. So with this roadmap and this money and recruitment need, you just go to see investors and incubators to say, okay, now I have this project, please help me build it. And I think that's when the incubator comes in and the incubators will bring many experts, legal experts, business experts, market experts, product experts, and they will just challenge you. And with the challenge, you will answer questions, you will precise your project. And we are still doing it right now. Yesterday, I was speaking with an entrepreneur who developed a medical device. He told me, just be careful on that. Just be careful on the part when you will produce it in a factory. Just look at the CE marking to be able to sell it in Europe, because it's not the same as selling it in Africa. So it's all of the time. And I think one of the most important lessons I've learned from these people is that you need to have to be surrounded by good people willing to help you and that are interested in the project, that have the same motivation as you.
Yeah.
It's the same for the team we recruited. Without them, we are nothing. So you need to have the right expertise, you have the right motivation, and just go.
Yeah. So talking about the team, what makes a perfect team in a diagnostic company? Like because sometimes we are scientists, or we talk about science, but sometimes we miss the IT people or the financial people. So what makes a perfect team, do you think, in a diagnostic company like Epilab?
I don't think my team is a perfect team, but I will take my example because it's how we build it. So basically, at the beginning, we have a CEO, Maurice. So Maurice is business oriented. He's market oriented. So we talk with the clients, we talk with the who, with the gates, we talked with the health department from the country. So we say, okay, we have this product, how does it work? So you need a business guy. The CEO will do business, will do legal, financial, administrative, and everything. So all the paperwork. The CEO is business and paperwork in our site. But you need business guy, paperwork guy, which can be the same. You need a scientific reference. For us, it's Muriel, so she's the CSO. You need the technical guy, so someone, this is basically my role, taking care of the product, taking care of how the R&D work, the development work is going on. So you need to manage all of the work.
Yeah. You
need some lawyers. The CEO has to look at the financial, so the paperwork is financial, legal, IP. You have all the paperwork with the French administration, but that's another thing. You need a few, I think, engineers and scientists working in the R&D. So our R&D team is composed of a PhD girl who did her PhD on the development of a macrofluidic chip on mycobacteria. So she's the core of the scientific R&D we do here on the ground. We have an engineer from Arts et Métiers who is basically a counterpart on the R&D work. So she does the R&D scientific, he does the technical and engineer R&D. We have an intern working with them. So they are the three people doing the R&D. We also have a doctorate student working with us. So he just started the doctorate with us, and he will work in the lab. So you have to work on the sputum sample. So I think you have to have someone who's focused on the medical part.
Yeah.
And then you will adjust it. It will be more, the answers will be more on depending on your project. So for instance, we will need someone on the electrochemical part. We will need a specialist in electrochemical, but I think you need a CEO who is good in business and in paperwork.
Okay.
And finance.
But for the legal part and for the IT part to handle the website and for do the social media marketing, we don't have. You think that we don't have to recruit them in a team, right? We can just. Yeah.
I mean, it's you can I do it myself. For instance, the website, but it's not the perfect website, of course. But as my product is not destined to it's the people who are going to my website are not my customers. We are not buying some shampoo and going on a website of shampoo and say, okay, this is great, I'm going to buy some shampoo. Maybe you're an investor looking at the website and say, okay, I have the information, this website looks good, it's okay. Let's talk with those people. So for instance, the website and the communication, we do it ourselves, even if we are, of course, helped by a communication expert. So we have someone who tells us, okay, when, for instance, we are communicating for the fundraising, so someone just help us. We talked with a press agency who told us, okay, if you want to communicate in a good way, you need to contact those journals. Yeah. So I think you really have to have a strong scientific and R&D and engineering core to develop your medical device. You need, I forgot, you need some regulatory affairs and quality guy. You need, I believe you need a quality and regulatory guys, an R&D team, a CTO managing the projects and the R&D, a CSO being the scientific reference, and a CEO leading the finance, the paperwork, and the business.
Do you think about, so what's the target of the company? To reduce the team members, or to, because most of the time it becomes a burden for the company, right? If you hire a lot of team members because you have to pay them. So what do you think?
That's when the roadmap comes in. So in the roadmap, you say, okay, I need to recruit this and this and this and this and this. So I need this money. So if I recruit someone, I think it's my responsibility as one of the founders of the company to make sure that the first thing is useful to the company, and the second thing, I have enough money to do that. So I think it's a mistake from the entrepreneur to hire someone that's not useful and that you cannot pay. I mean, you cannot just hire someone and say, okay, let's see in 2 months. Mm. It would be a mistake for me to say, okay, Quentin, for instance, one of the team members, wow, is not useful. That would be because I didn't think enough at the moment when I recruited him.
Okay, so we are in the end. So this is your story and this is Epilab's story. But you saw many challenges. You fought with it and you learned something. So now at this stage, what precautions will you follow if you have to start a next startup?
I think the most important thing is the human part. Really, for the recruitment, you will recruit someone who has the expertise. So this is true. but you will find many people with the same knowledge, and in the end, your project is so precise that no one has the perfect knowledge. So the most important thing is to have the human around you vibrating with you. It's a bit deep, but it's really important to be sure that you are working with people with the same vision as you, with the same motivation as you, and you get to ask for that. Like when we started the company, we did a 2 hours meeting with Elodie, Muriel, and Maurice, the four founders. Say, okay, what do you want to do with Epilab, and why would you work with it? Is it because you want, Muriel, is it because you want your project, your technology to do something in the world? Elodie was, because I love the science, I love to see just how it will go. Muriel was, I would just want to see my project going in the world. Maurice and me were just, okay, we are engineers, we benefited. We had an amazing education from France and from our school, so we just want to put that in a project that makes sense and that resolves the problem. And we say, okay, if in 2 years some company will just want to buy the Epilab, what do we do? So you want to be aligned, to have the human around you, your team, your advisors, your investors, even your partners. Everyone needs to be in the same vibration as you. So this would be a first.
Yeah. Is everyone working as a full-time employee or?
Not even Muriel and Elodie still have their teaching part in their work, so they are part-time, but the time they are working with us, it's full-time. So I think the first thing is you really got to have some people around you with the same vision, with the same envy, and if it's not the same, you have to know what they want to do and why they are here. Like if someone I'm just here because I need to work, I need to have some money, it can be good. It can be good. If someone tells you, I don't care, I just want to make my work in a good way and leave at 6 p.m. and that's all. It's not a problem, but it's better. It's better, of course, if they are motivated by the project. But you just need to understand the people around you and to make them vibrating with you. The second part is that you have to work on yourself because creating a company is not easy. So you have to be ready to face challenges, and you have to be ready to know that your personal life and your professional life will be really the same. So they will mix together. And if you are having problems in your personal life, it will deeply impact your professional work.
The discipline is the most important thing for an entrepreneur.
Yes, and maybe the last. I know I'm talking a lot. Can I add one last thing?
Okay, sir.
The more important thing, but I think it's not even as an entrepreneur, but it's even more important as an entrepreneur, is to go to start thinking I don't know anything on this subject. It's the most important lesson I've learned during these years as an entrepreneur, is that I didn't do anything myself in the beginning. I was just only asking questions. But at one time you say, okay, this I can do myself. I know it works. And 99% of the time, okay, like for instance, the recruitment of someone. The first recruitment with Maurice, we said, okay, we'll do it ourselves. We don't know we didn't even think about asking to recruitment experts because it appears to us that it's something natural, but nothing is natural. You always have some amazing advices to take from people. So this is the most important, and I think it is the most important thing in life. When you want to start something, just ask to the expert, to experienced people. And they don't always say the perfect thing. Just take some advices from many people as you can. And this way, you will not make the same mistake as them. You will go straight to the point.
So Epilab is the diagnostic company and you are working in the diagnosis. So you know the trend. So what would in your thoughts, so what would the diagnostic startup look like in the next 10 years?
They will make a point of care and portable diagnostic like us.
So at home we can diagnose like a COVID we don't need to do the PCR, right? We can just detect the COVID at home with more precision.
I think so. And I think even before the precision, just being able to detect most of the diseases quickly anywhere in the world. It's not even at home. You can be there's an expression, it's called point of care. So point of care means where you are cured, where you receive your care. So most of the diagnostic company are focusing their work on point of care tests, because we can diagnose basically anything in the world, but if it takes 2 weeks and a lab and 10 people, like it does today for the PCR, and like it does today with most of the diseases, it's going to be a problem. It's going to be a problem in our country, and it's going to be a problem in low-income countries. Even more problem. Okay. And so we just to say that I'm not saying that out of my head. We spoke with many diagnostic companies, and the one focusing already on point of care, their value tripled or to 10 times in a year, because they just know how to make point of care, and you know how many PCR tests are made for COVID and how many rapid tests are made for COVID. This is just obvious, and this is going to be the same for many diseases. I believe. But I think PCR is still in the development phase. So if you have a good PCR, it's a good thing. Just it's way more complicated to develop.
Yeah. The PCR is more trusted, but we are using the PCR since long time back. So is there some method like using the microfluidics with a better precision than the PCR, because it's a little bit complicated, right? PCR is a little tricky, and we need some expert to do the PCR. So.
That's it. You have some PCR machines, but they are way too expensive, and you cannot pay every diagnostic $100. It's better to pay a diagnostic $5 and to do it quickly and at home. And then if you have some doubts or if you want some precision, you can do the PCR. But the point of care diagnostic market is just a growing and growing market every day.
I'm from Nepal. And do you think there could be any collaboration strategies from Epilab with
of course,
hospitals or like that? Because we also have the tuberculosis, I know that. So do you think the Nepal could be a potential market of Epilab, or is there any collaboration we can make?
I strongly believe if we are looking for partners all around the world. So because once our test is ready, it's not going to be enough to say we tested it on 100 patients in Benin or in Paris. We are going to need to prove that this test works everywhere in the world. So of course, I think as many partners we can find, the better it is for Epilab.
So I think we are at the end. So thank you so much for your time. I hope Epilab makes a great impact. And so finally, how can someone who wants to connect with you can find you and your company?
So you have to write Epilab, E-P-I-L-A-B, like that, on Google, and I can send you my email. My email would be c.dubois, D-U-B-O-I-S, @epilab.io. But you can find you can contact us on the website. There is a contact form. So don't hesitate. I would be happy to help anyone who has some question. And this is a good idea what you're doing, Sebastian. I think I would be happy to talk more with you if you want, and maybe in person.